the viewers, this is Hemant Sharma, one of the transplant surgeons at Royal Opal University Hospital. I specialize in transplantation surgery, as well as looking at the big data analysis and the machine learning. This is one of the studies which we presented at ASGBI Annual Congress in the BGS Prize session, and we won the first prize for this presentation. The title of a presentation was Comparative Outcomes of the Black and Caucasian Kidney Transplant Recipients in the United Kingdom. It was a COBIT analysis done by myself and my colleagues from the transplant unit at Royal Opal University Hospital. Authors have no conflict of interest. So looking at the evolution of the kidney transplantation in Black patients, and we divide it from the eras from 1960s to the present. In 1960, it was an early transplant era. There was limited access to the Black patients due to segregation and discrimination. But in 1970s and 80s, there was recognition of disparities. There were documentation of lower graft survival in the Black recipients. And there was slight emergence of the research on the immunological differences between the Black recipients versus the other recipients. 1990s was the era when we identified the barriers, looking at the socioeconomic factors affecting the access and the outcomes. But then came year 2000, where there were focused intervention globally, including at the implementation of the allocation policies to address racial disparities. There was research on the immunosuppression tailored to the Black recipients. From 2010 onwards, they've been striving for equity, looking at the focus on the social determinants of the health across the globe. And also, there's a continued strive for improvement for the long-term graft survival and the patient survival in the kidney transplant recipients from the Black population cohort. Looking at the evolution of kidney transplantation in the UK, it is mirroring what was happening globally. In 1960s to 80s, there was limited socioeconomic barriers. There were no policy developments, and the data and research was very sparse. But from 1990s to year 2000, there was recognized disparities. There was systematic data collection, and there was initial policy discussion in the country. From 2000 to 2010, there were targeted donor campaigns, and there were more allocation system revisions. But since 2010, there have been more race-neutral policies which have been implemented in the countries, and there's an ongoing equity initiatives going on. Looking at the evidence we have, this is one of the papers from the SRTR looking at more than 100,000 patients from the US population. Despite being 1/3 of the total population of the patients getting kidney transplant, the Afro-American or the Black population had a dismal 62% 5-year graft survival and 32% 10-year graft survival over the years. Now, this was pretty low compared to the white population, the Hispanic population, and the Asian population. This is one of the other studies that is also being widely quoted. It looked at around 307 patients, looking at all the patients from the different ethnic minorities. But here also, it was proven that the Afro-Americans who had the poorest graft survival compared to the Hispanics and the other population group. There were more reasons put out for the poor outcomes, looking at the higher HLA mismatches, high PRA, hyper-responsiveness, more rapid immunosuppressive metabolism, genetic polymorphism of cytokine production, and gene variation leading to racial disparity in post-transplant outcomes. While the whole evidence was geared and reported to prove that the Black recipients have a poor outcome, there came the study from the UK. It was a retrospective cohort study that looked at the kidney transplant recipients of 62% were white and the 66.1% were Black. But the study for the first time proved that Black recipients did not have a risk of death, increased risk of death compared to the white recipients. It was not, the ethnicity was not associated with the increased risk of death center graft loss. Now, this was a bit of a surprise coming from the UK. This study proved for the first time that Black population has equivalent outcomes compared to the Caucasian outcomes. But this was only a single center study. Until date, we do not have a comprehensive data on the long-term transplant outcomes comparing the Black and the Caucasian recipients. Henceforth, we took this study looking at the examination of the trends and the comparing outcomes of the Black and the Caucasian kidney transplant recipients in the UK. We used the NHS-BT National Registry data, which is a part of the ongoing project It was it was the period included was between year 2000 2019, and the data source was UK Transplant Registry. We looked at around 19,385 patients. Black recipients were around 9.7%, and the Caucasian recipients were around 90.3. It was only first-time kidney recipients which were included, and multi-organ transplant and the retransplant recipients were excluded from the analysis. We collected the recipient variables, the donor factors, and the transplant-related data. We took the statistical analysis, including chi-square test, Wilcoxon-Ransom test, Kaplan-Meier curves, and Cox proportional hazard regression ratios. Looking at the baseline characteristics, there was no difference as far as the age, female gender, living donor, HLA mismatch group, CRF, EGFR at 12 months, and the acute rejection rates between the Black and the Caucasian population. Looking at the temporal trends over the last 20 years, since year 2000, there were only 49 recipients in the year 2000 who, from the Black population who got a kidney transplant, and that has increased to 250 transplants from the Black population in 2019. Meanwhile, there was an increase in the proportion of the Black recipients from 5.8% from year 2000 to 9.1%, and that was a very welcome change for the country. Looking at the living donor transplant, the Black recipients were less likely to receive a living donor transplant. 9.7% Blacks versus 25.6% Caucasian population received a living donor transplant, and the odds were nearly half of the Black population to receive a living donor transplant. Looking at the graft survival rate, there was no difference between the white and Black population at 1 and 3 and 5 year graft survival. Looking at the log rank was all above the 0.05 mark. The outcomes in the highly sensitized patient showed no difference in the acute rejection rate, graft survival of 1 year, graft survival of 3 years, and graft survival of 5 years, and there was no difference in the outcomes. Delving further into the graft survival by ethnicity and donor type, there was no difference between the living donors and the deceased donor transplantation between the Black and Caucasian population. Looking at the graft survival rate by ethnicity and DRI, as the DRI go up, it meant more immunological risk, but the outcomes were nearly the same between the Black population and the Caucasian population. By the recipient age 2, either it was young or old, there was no difference in the graft failure rate between the Black and the Caucasian population. Though a study proved that there was no difference in the graft survival and the patient survival between the Black and Caucasian population, but our study also had some limitation. It was a retrospective analysis. There was a lack of granular immunosuppression data. Every registry comes with a selection bias, and we did have a selection bias. And registry data reservations are still there because there are a lot of missing data, at least 10% of it, which was excluded from our analysis. So overall, we have proven that renal transplant outcomes of Black population are no different from the Caucasian population. There has been a progress across the country for the equity in the kidney transplant from the Black patients in the UK, but there are still some residual disparities. And this analysis highlights the need for continued effort to address these disparities and ensure optimal outcome of all kidney transplant recipients, regardless of their ethnicity. But still, there is one question that will haunt again and again. Why are the outcomes of Black population in the UK so different to the US? And this could be done by further analysis of the UNOS database compared to the UK database. In the author's opinion, it is probably the health system that is making a difference, but that needs to be affirmed by further analysis. We acknowledge the NHSBT for giving us the data, and also the Epidemiology and Transplant Study Group initiative at Royal Liverpool Hospital for making the study a success. We wish to declare that this is a subgroup analysis of the NHSBT project, comparative renal transplant outcomes in kidneys from elderly donors more than 60 years compared to the kidneys from donors less than 60 years, a UK registry data analysis till date. Thank you very much. I would really like to thank all my viewers who have watched this video for watching this patiently, and I'm really thankful to everyone who has been a contributor to a study. Thank you very much. Thanks a lot.